You're welcome back to Sunday Breakfast right here on ChannelOne TV with me, Efua, Andrew Duncan. For our nutrition segment today, we're talking malnutrition and muscle mass loss, reducing risk among cancer patients. And so if you have any questions, as usual, send them to the WhatsApp number 0204 447 033. 0204 447 033. Alternatively, go on our social media, use the hashtag Sunday Breakfast, and we'll ask those questions here for you. And you're welcome.
Thank you.
Yeah,
Thank
angelic
you.
in white. You look very nice.
Thank you.
How are you this Sunday?
I'm good.
You look tired, though.
Tired. Very, very tired. The small girl is going to school sleepless night, looking for this, looking for that.
Oh,
wow. Yeah,
SS?
Yes.
Oh,
okay. The joy and the
anxiety,
the stress of motherhood, all coming together really nicely.
Yeah.
We wish her well. We're talking about our school experience today. It can be much.
Yeah.
But it can also make or not make you, right?
Yeah.
Sure.
But we'll be praying for her and for you. And not anyway, amazing.
Yeah, we're talking about nutrition and muscle loss in cancer patients. What is all of that? This looks like a mouthful of words.
Okay, so malnutrition in general can be overnutrition or undernutrition. So malnutrition is where there is an imbalance between the nutritional needs of the body and what the body is receiving. Okay, so undernutrition is when you are not taking enough, so there is a deficiency there. Okay, and overnutrition can also be where the body has too much of what it needs to function adequately. Okay, but in cancer cases, we are always dealing with undernutrition. Okay, so the body is not able to function well. You have a very slow healing process. You are not even able to respond well to treatment because the body doesn't have the adequate nutrient to support the healing process. Okay. So undernutrition can be caused by lots of factors. And when these factors are not treated well or even early diagnosed, you see, the patient breaks her fats and muscles, and so you become weak and you are not able to have good quality of life. So that is where you have the muscle loss, because you are breaking that one for energy. So undernutrition most of the time results in loss of energy because, of course, you are not taking enough, and most of the time, because patient is unable to eat well, there is that loss of the muscle mass. So it shows physically by the unplanned weight loss. Most of the time, when you want to lose weight, it has to be planned. But in disease cases, especially cancer cases, it cannot even be controlled.
How often do cancer patients lose muscle or even become malnourished? Because I know that you can't really eat well in specific cases. Okay,
so there is disease-related or the cancer-related malnutrition. Some of the tumor will affect your appetite, or affect your digestion, or affect absorption. So because you have lost lots of appetite, it becomes difficult to eat, accept food and take. Sometimes even the pain associated with the disease even make the appetite difficult to have. So these disease-related factors are there. Definitely, because the patient is in pain and the tumor or the disease has affected absorption, you will lose the weight because you are not getting the nutrient to support loss, the healing process, and even to support growth, to support the quality of life. Sometimes also treatment-related courses are there, where if you're undergoing chemotherapy or radiotherapy, or even if you have gone through surgery, you would feel nausea, you'll be vomiting, you'll have diarrhea, you might have constipation in some cases, you might have abdominal pain. All these make it difficult for the patient to eat enough. Sometimes they can't even swallow. Other cases, they can't chew, okay? And in all these, because you are not taking much, and unfortunately, that is also the period the body needs a lot of nutrients to support the healing process. So because the body needs more and you are not getting, it breaks down the fat, it breaks down the muscles, and the weight loss becomes so fast. So somebody is diagnosed, and few months you realize that they have lost a lot of weight. So this month of breast cancer awareness, we have also got to know that in Ghana, most cases are diagnosed, 80% of cases are diagnosed at the end stage. Okay, and that is a period where anxiety sets in, depression sets in. So this also makes the eating difficult. So all these factors put together really encourage malnutrition.
I'm guessing the malnutrition and muscle loss might affect your treatment as well.
Of course. So when you are not well nourished, okay, sometimes even the surgery has to be delayed. So you have an inpatient, and doctors will have to ask dietitian to boost the nutritional status before she goes to surgery. Sometimes that can take even a month.
Wow.
Because we are not getting the status to support the operation, okay? Because of that, the outcome of the treatment becomes negative, okay? You are not able to get really positive health outcome. So malnutrition is very, very critical, and it is necessary to have that nutritional screening assessment when you are going through treatment. Your doctors or nurses will check for your appetite level, or check whether you are able to chew or even swallow well. Even if you're able to swallow, how long do you keep the food in your mouth before you swallow? Okay. Sometimes you would think that this is end stage. No. Sometimes even early stages, patients are unable to chew fast or eat fast. So just a little food, she will take a long time to eat. She eats a little and it's okay. She doesn't want to eat again till evening. She doesn't even want to drink water, and all that affects the outcome of treatment. Yeah.
What strategies, can help prevent muscle loss in such a case?
Okay. So during when you go to the hospital, most of the time doctors will do the screening, and when you meet your nurse, doctors will do the referral to see a dietitian. You see a dietitian, they will do assessments to know your intake level. What symptoms are you showing? If you have lost appetite, if you are unable to chew, if you are unable to eat normal meals, if we have to make it soft, they will make it softer for you. Normally, we eat small, frequent meals and take lots of fluids, okay? Right. So if you're unable to chew, good. When that has been diagnosed, they will puree your meal for you and make it more frequent, okay? So that the goal is that you are supposed to get enough to support the treatment level. If we are unable to do that, you break down easily. And sometimes also, when it has become very critical, there is another way of feeding where a patient can feed through the nose. Okay,
nose.
so yes. So that is if we are feeding the patient through an NG tube. Okay, that is normally when it has the disease has progressed to a certain stage. Okay, but normally eating small frequent meals and having your snacks. So if we say small frequent meals, we are assuming you can eat 6 to 8 times in a day, okay? Just every 2 hours or every 3 hours,
right,
so that you will have enough energy, you have enough nutrients to support the healing process, so that the body doesn't have to break down your fat and muscles to give you energy, so that you need, you know, this is also a stage of high protein, okay, intake. You need high protein, so you are supposed to take the protein. However, so some of the protein can be in a powdered form. There are powder protein in there. Some can be mashed. Some can be even made into liquid. However, it can be done for you to take. We ensure that you are taking it as well. And then food also must be enjoyed, okay? Yeah. So when an adult is on peri or a fluid diet, it's as if they have lost that enjoyment of food. No. Yeah. When you psych yourself that this is what the body needs at this time, and you need all the supports to be able to increase intake, you should accept. Sometimes it is the acceptance for. So when you take a man, you tell a man that I'm going to peri your food. That alone, sometimes the depression alone make them reject it. Okay, and we should also know that some of the complications of malnutrition is cancer-related deaths.
Wow.
Because if you are not getting the nutritional supports, the treatment is not going to work well, and so you are not able to fight back. You don't have the nutritional support. You don't have the nutritional status to boost your immunity to fight the disease, and you also easily get infection because you are prone to other diseases, okay, to other infections as well. Yeah. So the strategy is small frequent meals, and if we say small frequent meal, not eating just anything. You see, because you are not able to eat much, the little you are supposed to eat should be dense, okay? This is the period where you plant even a small cup of porridge, making sure that all the energy you need are there, all the fats you need are there, all the protein you need are there. The vegetables, if you are not able to chew, and we have to peri, we peri and add other sources of fiber, because you really need the fiber. So other sources of fiber to make it a complete meal for your status. So because patients don't have appetite, they just eat anything. When they feel like eating, they just eat anything, okay? And that do not give you the necessary nutrient to support the healing process. So a plant meal is very, very important. If there is any restriction at all, that is the time you tell yourself, enough of whatever I have eaten in the past. This is the time to build your immunity to fight the diseases, and you will be able to.
I have a question for you, but I'm just curious to know, how difficult is it for you as a registered dietitian and nutritionist for health patients, you know, when you make their food for them and, you know, they don't really like the food, but they have to eat it? Like, talk us through the process. Is it like very difficult trying to convince them to eat it? You know, what's their mental? Or for example, if I'm sick and bring me agushi, like, the only thing you can convince me to eat agushi kontomire is like, you tell me that that's where my healing is coming from, right? But listening to you, sounds like people really go through a lot to be able to accept that now they can eat this and they can't eat that. Okay. Very briefly on that.
So because normally this kind of disease is diagnosed at the end stage most of the time. Either you are stage 3 or 4.
Yeah.
Most people approach it, or most of them are shocked. Okay, so there is that anxiety and depression. So that's impair appetites. Most of the time, if you are telling a patient who didn't used to like vegetables, to eat vegetables, who didn't use, especially when it affects swallowing, now we have to puree the food for you. Oh, you have to talk to them. There was one patient who had, I've forgotten the type of cancer, but was a big man. So we were told 3 days after treatment, like when we have started treatment, because I am in charge of the inpatient, I was supposed to give him food every 6 times a day. The 3rd day, I was told, look, all the food you prepared yesterday were there. 3 days ago, we had to throw away.
Wow.
So this is 3rd day and it's afternoon. He has refused to receive visitors or even take medication.
Wow.
Okay.
So it's having a psychological toll on him.
That is a difficulty, and that is common among cancer cases.
Wow.
So you have to really talk to them to accept. Sometimes we win, other times they want to go.
I feel you. It can be really difficult.
Yeah, very, very difficult.
Wow. Again, back to the conversation around muscle gaining and muscle loss, right? So for example, if there's someone who is gaining muscles and working actively towards it, how are you as a dietitian able to tell that, okay, this added weight is fat and is dangerous for your health, or this is actually muscles and would help you build immunity to an optimal level?
With cancer cases, they don't build. Okay, when you are dealing with cancer, you don't gain
weight at all,
because
even when you binge eat,
the disease itself increases the need for nutrients and energy.
Because cells are dying.
Yes, so there is that increased need. So you will break. So you are supposed to eat to maintain. So all that we are doing is to maintain. It is difficult to gain.
Add.
Yes.
Interesting.
Yes. So even being able to maintain means eating quite frequent and eating planned meals. Okay. It will be very difficult
to say that you are gaining weight during that period.
No.
Anna, there's a question here for you. Hi, at which stage can muscle loss be irreversible? And this is from Siemens.
So when a patient is severely wasted, severely wasted, but even that, when you go through the right care, okay, it might take a while, but when the treatment is successful, you will gain back. You will come back to good health, and when your health is improving, you gain the weight. Yeah.
Do different cancers require different types of nutrition?
Mostly yes, but generally no. Okay. Mostly yes, because when there is an organ failure, that is where it is the type of organ that will require the type of elimination to do. But in general cases, we're doing high protein, we're doing high fiber, we're doing good fats, and that is all to support immunity and also increase the nutrients for the nutritional needs at that stage. Okay, so generally, every cancer is high protein, high fiber. Okay, but depending on the type, like if you have one in the GIT, okay, or even if the patient is unable to swallow well, okay, you are trying to eliminate, even that you don't do elimination, you do manipulation, okay, you do that to help with the swallowing. The only elimination is the artificial foods, okay, so because we all know artificial foods do not supports good health.
Right.
Yeah. But all the natural organic ones are acceptable.
Is it possible to reverse muscle loss after maybe, let's say, you are cleared of cancer?
Yes, yes,
It
yes.
is.
You gain the weight. You gain the weight.
Okay.
You gain the weight. Yeah.
Let's come back to this. I wanted to know whether you tailor specific nutrition for maybe early stage and then later stage, like
Yes, yes. So all the stages and their nutritional requirements. So how far, because we work with labs, okay, we see the physical signs, we see your results from the labs. So that's determine what to do. So most of the time it is based on your physical nutrition examination and also the lab results put together. We are able to tell. So there is no general rule. It is disease specific, patient specific. Okay, somebody might be very anemic. Others, they are getting to end stage, but they are not anemic. So it is not a general
rule.
It is not a general therapy.
Okay.
It is case specific. Okay. Some of them, I had a patient who after every chemotherapy section, you have to give about 3 hours to endure the pain before he could even take water. And there was another one, surprisingly, whenever he comes back to the ward, that was when he was calling for food. Okay, so for such a patient, the approach is different. Okay, even though he was eating well, unfortunately, absorption was impaired. Okay, and the need for nutrient had become so high that because we needed to give her more and she was eating well, she could really heal fast.
Wow.
Okay.
I'm guessing cancer, like, you have to work in line with a psychologist because it's all up here.
Yes.
If you don't want to fight it, you won't be able to.
Yes. Sometimes to the pain, okay, the pain, it can be so much that you just cannot see food to be important.
Right.
Okay. And the clinical psychologists really work hand in hand. They are part of the team. Okay. So if the patient is rejecting the food every day and is not happy, depression is a very common factor. Okay. So they come in, you talk to them, they accept. You will let them see the light at the end.
Of the tunnel.
So when they see the light, they are prepared to face it. Lots of people are able to come out. Okay, lots of patients don't end that bad. Okay?
Right.
But if they are able to accept it and they are able to eat well, the nutrition is very, very, very important. So however, sometimes a patient is able to swallow, but because she's not able to take much, we decide to do mixed feeding, okay, so that we do oral a little and then more intra.
Right.
So oral a little, oral, maybe you take about just 3 or 4 tablespoons without an hour. That will not give us results. But if I can do 250 ml through intra, then I'll pass the NG tube and do both.
Right.
Okay. And with that, you could see that the patient is able to take enough and the healing process become very faster. The problem really have to do with outpatients who are up and going, but have issue with nausea, have issue with vomiting, have issue with constipation. For them, because it has to be oral, it is very difficult.
So when they eat, they just bring everything back out?
Some of them after chemo, you really vomit a lot. Okay, and so that makes it difficult to keep it in. Okay, so it becomes very important to make the food in a fluid way, okay, to improve the hydration and also give the nutrients as well.
Yeah. And I thank you so much. We appreciate the conversation, and I'm sure we've learned a lot and we've picked a few things from it. Enna is a registered dietitian with Desua Diet and Medical Catering. We're going on a quick break. When we return, there's some sports. Don't go away.